Application possibilities of biomechanical computer models in medicine. Because the MBS features very short computation times and surgical planning is increasingly computer-based, preoperative simulations can be used to predict the effects of different surgical methods and to identify the best possible surgical option. Furthermore, in future a transfer of topographic and kinematic simulation data of implants in 3D planning and navigation procedures is conceivable. In this process, coordinates of the implants from the computer model and the 3D model data of the spine may be transferred to the navigation system in the appropriate data format. It should be noted that the MBS modeling of the biomechanical properties of the intervertebral disc represents an initial approach. Therefore, the implementation of FAE parts is indispensable to simulate patient-specific biomechanical properties. To demonstrate the medical application possibilities of the simulation, the effect of a spinal fusion under different load cases is exemplified by an appropriate computer model. For that the mechanical properties of the MBS model were adjusted, so that no residual movement in FSU L4-L5 is possible. Thus, two models of the lumbar spine were created. As in previous models, the upright position is used as the load case in this simulation, and also an external load of 600 N and 700 N is applied at the center of the vertebral end plate of L1. Detailed MBS lumbar spine model with fused FSU L4-L5. Considering only the disc force of the model without fused FSU L5-L4, it can be seen that the pressures in all FSUs increase with higher external force. Comparing the pressure of the intervertebral discs of both models, the disc loads of the FSU L1-L2 are almost the same. A deviation results for the other functional units. The pressure in the FSUs L5 SAC to L2-L3, of the model with fused FSU L4-L5, is lower than without fusion. Effect of a spinal fusion under different load cases, intradiscal pressure. In this case, a spinal fusion affects especially the loads of the facet joints. Clearly shows that after fusion, the forces in the facet joints are particularly higher in the upper FSU. Through such an increased load situation degenerative changes can be caused in the facet joints in long term. Effect of a spinal fusion on the facet loads. Comparing the intersegmental rotation of the discs, with and without fused L4-L5 disc, it can be seen that the discs of the fused model perform less deflection in the FSUs L5 SAC to L2-L3. The lower lumbar spine thus has lower mobility than in the non-fused state. This means that after an intervertebral disc stiffening, the lower lumbar spine would have a lower mobility than in a non-fused state. Effect of a spinal fusion on the intersegmental rotation. In summary, it can be stated that a fusion can lead to load redistribution. In this simulation case, especially the posterior structures that are located above the fused FSUs are stressed more than the ventrally located structures. A further example in the field of medicine is studying the effects of different body weights on selected surgical procedures.